model of the past that would not fit in the near term, nor did we believe could survive long into the future. Slide 7. So again, we believe that we had to think and act differently than we had in the past. To be proactive in that regard, we had to change faster than the world around us. We aligned our cultures. Each of our boards adopted the same set of operating principles. We had to build trust. We were totally transparent with each other. It was either that or we believed die with our respective secrets. We share a commitment to strengthening families and children. The breakdown of the silos that had existed for the collective 300 years of our experience was illustrated by one game-changing example. And that was, for decades, each of our organizations had submitted individual proposals to United Way for funding. Last year, we submitted one proposal, United, to provide a regional model of service delivery rather than 3. I'm pleased to say that the Alliance was awarded the largest single award in the United Way system last year. And our Alliance is driving efficiency, quality, and access at an unprecedented rate. Slide 8, please. To talk about the tangible results against the goals of efficiency, we'll start with the efficiency. The Alliance has adopted a common technology platform, and as you can see from the slide, our joint licensing of a state-of-the-art website client management system has saved us more than $250,000. The key, this common platform for technology will drive future efficiencies for all of our operations. The savings that we obtain will be allocated to increase our capacity to see more people. The Alliance will deliver additional financial efficiencies through standardized practice, policy, and procedure, joint training, professional development, an elimination of redundant business practices, administrative services, and joint purchasing. Slide 9. There's a wide range of treatment methods that result in varying degrees of quality. And currently, across the region, there are methods that vary from one clinician to the next, even within the same clinic. The U.S. Department of Health and Human Services certifies what they call an evidence-based practice when a treatment method has withstood rigorous analysis, demonstrated its effectiveness over time with diverse populations. Our Alliance is deploying a standardized, evidence-based behavioral health service delivery model across the region. Slide 10. The Alliance is also improving access. With 15 locations, the Alliance will be able to provide this evidence-based service model at a location convenient to where people live, work, or play. Another critical aspect to access is that first phone call for help. With our web-based technology, we'll be able to provide unprecedented efficiency and ability to schedule anywhere in our system with one phone call. Slide 11. Through our work to increase efficiency, we've become aware of the fragmentation that exists within and between the systems that we interface with. For example, there are currently at least 10 different systems where we must manually enter our client data as required by our public funding sources. 10 different systems that we have to manually enter our data. Imagine the potential efficiency of integrated standardized processes across all these various systems of the region and or the state. Our challenge as an alliance is to prioritize which efficiencies to go after, and our only constraint is the time and money to do that. Slide 12. A consultant recently completed a business process analysis of the Alliance organization and provided us with a roadmap to further integration. The consultant's work affirmed the potential efficiencies. We believe that we can achieve between $500,000 and $1 million per year in sustainable savings within the next 3 years. We only lack the capital to achieve that at this point. We're constrained by the time and money. Can't become before an appropriations committee without commenting that an investment in this transformational community service model would be greatly appreciated. But we thank you for the opportunity to share our story with you, and we're open to questions if you have any.
Thank you very much, Mr. Earl, and to all of you, and thank you for being so concise and brief. I appreciate your presentation, and again, one of the things I've been emphasizing, and you're doing it, you're collaborating through your joint systems, you're saving money together, but you're improving your systems as well. Any very quick questions for collaborative? Thank you very much for coming. I really appreciate it. I wish we could have shown your slide presentation, but I may have something on one of my cable shows just showing it because it's so excellent. Thank you very much. Appreciate you coming. I would like to call a second program that we've invited, Kent School Services Network, Mr. Ron Kohler with the KISD, Matthew Van Santen with the county, and Mr. Andrew Zylstra, Director of DHS there in Kent County. They're going to talk about a collaboration also in Kent County, and please, if you could hold it to 8 minutes or less, we'd really appreciate it. Thank you for coming, and thanks for your effort.
Hi, my name is Matthew Van Zetten. I'm the Community Collaborative Coordinator for Kent County, and I work in the Kent County Administrator's Office. I'm here today with Ron Kohler, our Assistant Superintendent from our Kent Intermediate School District, and Andy Zylstra from DHS, just to share briefly about the Kent School Services Network. This initiative started in 2005 with the goal to realign health and human services to support student achievement in our county. We were seeing an increasing amount of need from children of poverty throughout our districts, school districts. And as the county is a significant contributor to the human services framework and funding, we looked at ourselves and said, what can we do differently through changing our alignment of services in the county to improve student support and achievement? So we brought stakeholders together, and Ron's going to talk briefly about the program itself.
Thank you, Matthew. I think it's interesting and relatively serendipitous that today in the Detroit News there's a report by education researcher David Berliner which indicates that the conditions from which students come and they bring to the schools really impacts more on their achievement than what we do in our schools. Understand that most of our students, those without significant early or after school programming, are only with us about 12% of the time. And so, you know, we, all of the organizations that are in the handouts that we've provided you, the Kent Intermediate School Districts, the individual school districts, the Department of Human Services, Community Mental Health, and other allied service providers, took a look at the outcomes that we had with our students and said, how can we do this better? If we were to reorganize ourselves, what would we do differently? We in the schools understood that we can't do everything for the students, that our job is primarily to teach. And so we stepped back and said, what if we could really allow our principals to be the educational leaders they're building, and what if we gave teachers the time to teach and took more of the social and human services and health services off of their plate? What would we do? And what kind of outcomes would we see? And I think we've found, if you think of the contributors to the dropout crisis that we have today, 30% across our state, and some of our major metropolitan areas as high as 50%. The primary contributing factors to those dropout rates are students who have chronic absenteeism. They have health and other issues, domestic issues in their home that keep them from being able to come to school. They suffer a loss of literacy at an early age, and then they fall behind their age group in school. And the chronic absenteeism,